take this opportunity to, thanks for recording the webinar. I will take this opportunity to officially thank all the members of the panel, the Minister of Health, Dr. Joe Patla, Deputy Minister, Dr. Somiseni Dlomo, our experts from NICD, Dr. Chris, DG is also joining in the next minute or so. I spoke to him, was sorting out some connectivity challenges, and also the members of the media. My name is Foster Mohale. I'm responsible for the media relations in the National Department of Health. I'm going to be the facilitator of this media briefing as usual. So without wasting any time, I'm going to hand over to the Minister of Health, Dr. Joe Patla, to take to the podium. I see DG has just joined. Welcome, DG. Over to you, Minister.
Okay. Thank you very much. Thank you very much, Mr. Mohale. Welcome to and good morning to colleagues, to the Deputy Minister, Dr. Dlomo, and also good morning to DG, Dr. Buthelezi, Dr. Crisp from the department and other members of the department. From the NICD, Dr. Wasila Jassat and Michelle Groom, thanks for joining us. And good morning to members of the media, our viewers at home, and the listeners. It is exactly a month since we gave our last update on our efforts to manage the COVID-19 pandemic, and especially also provide progress with our main weapon against the pandemic, which is the vaccination. The last time we did this was exactly a month ago on the 4th of February. As you'll be aware that soon after that, the following week, it was the State of the Nation address. And as they say, the rest is history. There were many other events. But however, over the last 4 weeks, we have been in touch, keeping in touch with the public through various platforms of communication, making announcements, including on changes with the vaccination program, which we will speak to later this morning. Dr. Chris will give a lot more on the changes with the boosters and the schedules. Now, all that we're doing is to make sure that the vaccination is accessible, to protect the lives, and also to open up economic and social life. The COVID-19 pandemic continues to ravage the world, the entire globe, and our own country. Over the last 7 days, the World Health Organization reported that there were more than 10 million new cases in a week in the world, with more than 60,000 deaths in a week. And that really shows us that the virus is still, ravaging the world. The Omicron variant remained dominant, with 99.5% of the tested specimens which have been sequenced showing the Omicron variant. In South Africa, in the last week, we have seen a 20% reduction in new cases from an average of 16,000 cases per week to an average of 12,800 per week. The Gauteng province is still leading at an average of 38.4% of the new cases per week, and also per day, almost the same average percentage for Gauteng, followed by the Western Cape at the 20% positivity, no, 20% of the positive cases on a weekly basis, and followed by KZN at 15.5% of all the positive cases in a week, and on average also per day. In the past week, all provinces have reported a decline in weekly incident risks, except for KZN, which showed no change in the risk incidence. The percentage testing positive in the last week was highest in the Mpumalanga province at 14%, followed by the Western Cape at 12.6% positivity, and Northwest was the third at 10.5%, while all the other 6 provinces were having a less than 10% positivity rate. The percentage positive was highest in the age group 10 to 14 years of age, which was on average 21% positive in this age cohort, which is obviously worrying that it means that we're getting more positive cases at the younger age group of 10 to 14 years. We did say last time that this was possibly because of school opening, but it looks like the trend has persisted. The dominant variant in South Africa also remains the Omicron, although there's also a sub-variant of the Omicron called BA.2, which is currently accounting for 78% of the infections in January and February. But the characteristics are not, it still remains the Omicron, although with a sub-variant, which has been dominating amongst the young people. Currently, there are 25,758 active cases, which is an increase of 1.3% over the last 24 hours, which again shows that we're not declining at a rate at which we would have wished. In terms of districts, increases has been recorded in the Overberg district in the Western Cape, the city of Cape Town, the Francis Baard district in the Northern Cape, and also in the west coast of the Western Cape. 12 out of 52 districts have recorded increases in the last 14 days compared to 14 days earlier. Admissions in hospital as of yesterday stood at 2,602, which is an 8% decline over the last 24 hours. Over the last 7 days, there has been an 11% decline in hospital admissions. Now, very important is the confirmation again that 72% of the admissions are those of unvaccinated people. 83% of the admissions are in general wards, while 7.4% are in high care, and just under 10%, 9.6% are in ICU. So in absolute numbers, those who are treated in the ICUs are just under 250, at 248 as of yesterday. Deaths in hospital have also reduced by 28%, which is good, although we would have wished that nobody should still be dying from the COVID. The total fatalities as of yesterday stood just under 99,500, just I think two less than this, 99,500, with a recovery rate of 96.6%. Our major disappointment is that the rate of infections have not declined as steadily as we had wished for, that by this time we had to hope that by the time we reach the end of February, we would be at less than 5% positivity. We have seen recurring spikes in various districts, as I've indicated, 12 out of 52, which is leading to a plateau in the curve of infections instead of a complete flattening and decline to what we had hoped for. This has resulted in the last 4 weeks a plateau, which led to a positivity rate continue to linger between 7 and 10% over this last 4 weeks. As of yesterday, the positivity rate was at 7%. We're hoping to see more sustained decline, which will result in the positivity going below 5% in the next few days, and not, hopefully not weeks, but days, which will signal that the pandemic will again be under control. On the vaccination front, the vaccination continues to move steadily, but not at the kind of pace which we were hoping for. After remaining between 60 to 70,000 doses per day on weekdays over most of January and February, there has been a slight pickup over the last 7 days, seeing us going over 100,000 doses over the last 2 days, after a steady rise over some days, reaching 80,000, 90,000, and then over the last 3 days, we were able to surpass 100,000 doses in a day. As of yesterday evening, when the vaccination stations closed, the total doses administered stood at 31,879,000, which had been administered to just over 19 million adult individuals, constituting just under 48% 47.95% to be accurate, coverage of the adult population with at least one jab. In terms of gender, out of this, 56.5% coverage is for women, while men stand less than over 10% less of coverage at just 43.5% for the men. Individual adults fully vaccinated are just over 17 million at 43%. We hope to be able to pass the 48% in the next few days, which is nevertheless still a very far cry from the 70% coverage which we require for population immunity. Now, this will, if we were to reach the 70% coverage, this will make us able to open up a lot more activities and also reduce the need for a lot of the health measures. If many countries which have now reached 70 to 80% are able to do without many of the health protective measures. We are very pleased with the 70 plus age group cohort as the best performance, currently standing at 68% of vaccination coverage. The 50 to 59 standing at 64%. So overall, the over 50s have done well, and not yet at 70% coverage, but standing at 60% of full vaccination. The Free State province is still the leading province at 57.2% of vaccination coverage. And the other provinces, Western Cape follow, and then Limpopo and Eastern Cape also above 50%, the others at just over 45%. In terms of absolute numbers of vaccination, Gauteng is leading by far with more than just under 9 million doses administered, standing at 8.9 million, with just over 5 million people who have received a jab. Their coverage, nevertheless, stands at 45% due to the large population of Gauteng. Our biggest drawback remains the young people 18 to 34, who are only at 34% coverage, with only 29.3% full vaccination. We need at least 5 million more of this age group so that they could be pushed their coverage to at least 60%, which will also push the national coverage also to closer to at least 60%. We hope that the initiative by young people to drive the vaccination campaign of their own peers, which was launched just under 2 weeks ago, will bear fruit. The total doses which have been administered to the younger people, school-going age of 12 to 7, is now just over 1.65 million doses. As I've mentioned, as we have announced earlier, and as I said, Dr. Chris will speak more to that, we have made some changes so that which entail that the time frames for the second doses of Pfizer and the boosters for both Pfizer and Johnson & Johnson have been brought closer due to the available capacity and also the need to protect those who want to be protected. And we'll speak to this at the later stage in more detail. As I mentioned earlier, the young people have taken the step to mobilize their peers to take up more vaccination under the theme, "Ready," meaning I'm ready. The campaign is led by young health professionals, and ours as the Department of Health is just to give them the support. They are otherwise in charge of, fully in charge of this campaign, and we hope that it will make a lot of difference. The issue of vaccination mandates remains a difficult topic in our midst in the population. A team of senior government officials have been leading consultations with various stakeholders, including at NATLAC, and they should be ready to report to the next National Coronavirus Command Council with recommendations. While there are different views on this matter, the undisputed fact is that the more people vaccinate, the more we can open up the economy and more social activities, more sporting activities, more recreational activities, and there can be more social interaction as well. As I've mentioned earlier, countries which have reached up to some of the countries which have reached up to 70 to 90% coverage are now able to do without many of the health measures. During his SONA speech, President Ramaphosa stated that government has the intention to do away with the state of disaster as a tool to manage the COVID-19 pandemic. The Department of Health and other departments were given the task to come with other instruments which could be used to provide whatever safety measures will still be required to limit the spread and limit the impact of the pandemic. The Health Department has been hard at work revising its regulations to control notifiable infectious diseases. And the department is currently ready to present to the NCCC with recommendations of new regulations which can take over from the Disaster Management Act. As the World Health Organization stated at various forums, two of which I attended during the course of this week, including yesterday, they've emphasized that COVID-19 is not over. And as can be seen with the numbers which I mentioned, of 10 million new infections in a week and over 60,000 deaths in 1 week globally. And they've stated that we must avoid reversing the hard-earned gains we have made as we strive to end the pandemic. We hope that reviewed health regulations and other regulations from other departments will assist in guiding the reopening on various more economic and social activities, especially in the leisure and tourism areas, reopening with less risk of super spreaders. The proposals will include amendments to travel requirements, which could make it easier and cheaper to travel into South Africa and out of South Africa. Details will only be available after this proposed new regulations have been presented to the NCCC, hopefully in the coming week. We want to again make a clarion call to all South Africans that COVID-19 can be defeated if we all work together to protect ourselves and also protect those around us with the main tool, which is vaccination. One always feels very envious when participating in various international forums, including one in which I was participating yesterday with the various health ministers from various countries and continents, when you hear them mentioning that they have now reached a coverage of 70 to 90% of their population, which enables them to open up many activities, including sports activities with full attendance. So the future of this country is in our hands. We can reach where the other nations have reached. We have enough stock, enough capacity, which if taken up, can take us up to where these other countries are, so that we can be able to open up, but avoid super spreaders and be able to protect lives and avoid illness and death. We have a few weeks and months to claim our place amongst nations of the world. Beyond this year, it will be very difficult to interact with other nations of the world without vaccination. Let's make sure that we are not left behind. It's time, as our young people have said, we should all be ready to take our place on the vaccination queue so that we can be able to have full integration with the rest of the world. Thank you very much.
Thanks very much, Minister, for that update as far as vaccination is concerned. Indeed, the fact that the pandemic is under control does not mean we must lower our guard. The struggle continues. The fact that we continue to report at least a few number of deaths every day, it means we are still in trouble. So we must continue to vaccinate in numbers in order to be integrated with the rest. So without wasting any time, I'm going to call upon our colleagues from NSCD who are going to provide us with the epidemiological report as far as the vaccination is concerned. Over to you, Dr. Michelle and Dr. Wasila Jasat.
Good morning, everyone, Honorable Minister, Deputy Minister, colleagues and members of the media. So just a global update, just in terms of where we are with the global pandemic. You can see we had globally, there was a very large spike in infections in the recent months, which were driven by the Omicron variant. But in all regions, the number of cases of infections are coming down. And here you can see just in terms of deaths, at the top is infection. So you can see that big spike, whereas in deaths, we really are seeing deaths which were much lower than we're seeing with previous waves globally. In South Africa, just over 3.6 million cases. We continue to see a week-on-week decrease in the number of new cases detected. So the tail end has been, the decrease has been slower than what we've seen in previous waves. So we had this very rapid rise with, when the Omicron variant took hold, a decrease, and we have had this lingering tail of infections. And I think just important to note that although we're not seeing the same kind of, quick fall off of the wave as we've seen previously, is that we're in a very different point in the pandemic, and we have been decreasing the restrictions, and in line with that, I think it's not unexpected that we would still see infections. And I think the metric really, as you'll see the presentation by Dr. Jasat, I think it's important to be monitoring the hospitalizations and deaths. And I think we've been seeing continuous decreases in that. And so I think although there is this low level kind of plateauing of infections, it is coming down slowly, and I think really needs to be interpreted in light of the opening up of the economy and the decrease in the number of restrictions. Also, I think we have very high underlying immune protection, either through natural infection or through vaccination or through a combination of both of these. And I think we've seen this protection against severe disease. Just in terms of the Omicron variant, so since December, this has been the dominant variant. We have seen the rise of the sublineage, which is the BA.2, which is now making up the larger proportion of our sequences. Just to bear in mind as well, because the case numbers are very low at the moment, the number of sequences are also very low, and the quality of the sequences also tends to be lower because we're not seeing high transmission rates. And so although there has been some data from overseas showing there may be a slight increase in transmissibility of the BA.2, studies from South Africa have shown that there's no difference in the severity. So we have not seen any increase in severity with this subvariant. Also just showing, the trends over time. In the dark orange is the BA.2 and how we've seen this rapid increase in this lineage, but we're not seeing, as this sublineage is increasing, we're not seeing the same increase. This is the percent testing positive. We're not seeing, an increase in percent positivity in line with that new variant. Just in terms of weekly incidents, so all the provinces are coming down, stabilization in some, like KZN, which reported no change. And so we really are seeing the slow decrease in all of the provinces and nationally. Just in terms of age distributions, our highest incidence is still in our oldest population, the over 80s, and the lowest incidence in the younger populations. And we're seeing decreases in all of these age groups. You can see there was this increase in the under 20-year-olds in the school, particularly the school-going age groups. When schools opened, we had this slight second little blip in terms of those school-going age groups, or the under 20s. I think at that time we also opened up the schools to full capacity and all schools were back. We did away with the rotational schooling, and I think that may have been responsible for that. We've also seen the universities returning, and so I think that is still responsible for these small increases that we did see, particularly in the under 20s, but all age groups are now decreasing. In terms of our testing, our positivity rate is slowly coming down, and I think in this past week was the first time that we've come down below 10% since the fourth wave. So although the decrease is not as rapid as we saw after the third wave, we are coming down in terms of the positivity rates. And as I'd said, in terms of case incidents, I think really just have to bear in mind that we're in a different point in the pandemic. There may be different access to testing or willingness for people to go for testing, especially if they've previously had infection and been vaccinated. And so I think we do need to interpret this in light of the current state of where we are. In terms of percent positivity, we are seeing decreases in most of the provinces, unchanged in some of them, a very small increase in KZN, but really this is kind of negligible, just a 0.4 increase. Still highest in Mpumalanga. This is coming down, followed by Limpopo, but also seeing decreases. And you can really see the return to the kind of lighter blue and green colorations of the low positivity rates. So all the other provinces have dipped below 10%. Just in terms of the age, I think this is really just showing that most of the increases that we've seen in infections in the last weeks, kind of from mid-January and really coincided with the children returning to school, has been in these younger age groups, so the 10 to 14-year-olds, 15 to 19-year-olds, and to a lesser degree, the 5 to 9-year-olds. And so while we did see that peak, this was really associated with the back to school, because it was a week to 2 weeks after the schools went back. A little bit of a blip, I think, which was responsible for universities and also changes in the regulations at schools, opening up of all the schools. But in the past week, we are seeing decreases in all of these age groups. So I think just to summarize, Omicron is still the dominant variant. BA2 has increased from 5% in December to 36% in Jan and is now the dominant subvariant. I think just to note that we are continuing to monitor through our sequencing in terms of detecting any new sublineages or any new variants of concern. Nationally, we continue to see decreases in the daily new cases, the weekly incidence and number of tests, and we're seeing for the first time in this wave a decrease to less than 10% positivity overall at a national level. And we're seeing even in these age groups where we have seen the higher positivity rates in the last couple of weeks, decreases in those age groups as well. In terms of the provinces, all provinces are seeing decreases in weekly incidence or stabilization, where KZN was unchanged. Percent positivity, either seeing decreases unchanged or very small changes like in KZN with a 0.4%. And I'll just hand over to Dr. Jasat just to lead you through the hospitalization data.
Good morning to our Honourable Minister and all our colleagues and all the media that have joined. Today, I will take you through some of the hospital data available on DATCOV, but just provide a little bit of some of the other epidemiological analysis we've been doing. So many of you may not know, but I just thought I'd start off by saying that DATCOV was developed now 2 years ago as a hospital surveillance system and covers all hospitals in the country. But we also expanded a platform to allow for other modules. So we have a module where we monitor COVID-19 cases in long-term care facilities, in care homes, and we do surveillance there. We worked with the MRC and some of our pediatric colleagues around the country to develop a pediatric registry on DATCOV so that they can collect more detailed information on children who are admitted. We introduced a module on community deaths because, of course, DATCOV collects all the in-hospital admissions and deaths, but we didn't have a place to consistently and in a standardized way report out of hospital deaths. And so we now have a module, and all provinces are now using that to report their out of hospital deaths as well. We also are in the process of linking our data with the EBDS and, are able to look at questions around vaccine breakthrough, vaccine effectiveness, and hopefully, with the Department of Health, we'll soon start reporting on that. We also have a module on bed occupancy. So instead of just reporting on patient level data, hospitals are able to report on the number of patients admitted in high care, standard care, and ICU, and we can look at bed occupancy across the country during the waves. And finally, DATCOV at NICD, we also have a study on long COVID where we've been following up patients and will follow them up for up to a year to describe the prevalence and risk factors for long COVID. So DATCOV currently receives data from 407 public hospitals and 259 private hospitals around the country, which represents all the hospitals who have treated patients with COVID-19. To date, 506,000 admissions have been reported, with the highest numbers in Gauteng and Western Cape, and just over 100,000 deaths have been reported to DATCOV, with the highest numbers being in Gauteng, Western Cape, and KZN. However, the incidence risk of admissions was, once you take into account the population numbers, was highest in Western Cape, Free State, and Gauteng, and the highest incidence risk of COVID-19 deaths in hospital was in Free State, Eastern Cape, Western Cape, and Gauteng. So on the left, you can see the numbers of admission by public and private sector across all 4 waves. And you can see particularly in the second and last wave, more admissions occurred in the public sector, but generally similar numbers. In total, 276,000 admissions have occurred in the public sector and 229,000 in the private sector. On the right, you can see the incidence risk of hospital admissions by province. And you can see that, in all waves, Western Cape, Gauteng, KZN seem to be most affected. This is the number of COVID-19 in hospital deaths by sector on the left. And you can see that in each wave, more deaths occurred in the public sector than the private sector. And in total, 61,936 deaths were reported by the public sector and 39,111 by the private sector. On the right, you can see the incidence risk of COVID-19 deaths in hospital by province. What you can appreciate is that the incidence risk was highest in the second and third waves, and that the provinces that had the higher incidence risks were Western Cape, Gauteng, KwaZulu-Natal, and Eastern Cape. So this is just comparing the daily average of admissions and deaths in the current 2 weeks and the previous 2 weeks before that. And you can see that in all provinces, there's been a decrease in hospital admissions and a decrease in deaths that were reported from hospital. So this continues the downward trajectory of hospitalizations in the fourth wave. And we've now reached low numbers similar to the interwave periods previously. I just wanted to share some data with you on looking at admissions and deaths by age group. On the left, you can see the number of COVID-19 admissions by age group. In the first, second, and third wave, most admissions were in 50 to 59, 60 to 69, and 40 to 49. So sort of those middle age groups, 40 to about 70. In the fourth wave, however, most admissions were in the 30 to 39 and the 20 to 29 age group. So certainly a shift in the fourth wave towards more admissions in younger people. And I know a lot has been said about, the increased admissions in the pediatric population, but on the right, just to give some perspective, when you compare admissions in children 0 to 9 and 10 to 19 with adults over 20 in terms of the number of admissions, you can see that children make up a very small proportion of the overall admissions. And in fact, there were 31,797 admissions in children throughout the pandemic, which represents 6.3% of all admissions that have occurred. So that was a number of admissions. When you look at the incidence, which is the number of admissions over the population numbers, what's quite clear on the left is that the incidence of admissions increases with age. And so the highest incidence is amongst the over 60s, and of course it decreases with the decreasing age group. And that was true across all age groups. On the right, you can see just the pediatric population. And what was quite evident was that we had a higher incidence of admissions in the third wave, as has been reported before, and then an even higher incidence of admission in the fourth wave, particularly in very young children under 5. These are the number of deaths in hospital by age group in Epidemiological Week again. And again, you can see that most deaths occurred in the oldest age groups. But again, when you compare over 20s and children, children make up a very small proportion of deaths, only 0.8%. So only 827 deaths have been reported in children under 20 of all deaths, which is less than 1%. And again, when you look at the incidence risk of deaths, it's high increases with age. It's much higher in those over 60 compared to any other age group. And amongst children, the incidence risk is quite low and sort of higher amongst children under 5 than other age groups amongst children. So just some data around the patients admitted with COVID-19 and their comorbidities and risk factors for mortality. Amongst patients who we did have data on comorbidities, the most common comorbidity was hypertension, 26% of all admissions, diabetes, 17% of admissions, and HIV at 6% of admissions. TB was reported in about 6,000 patients, active TB, and previous TB in almost 10,000 patients. When we look at the patients who died and we looked at the percentage of those deaths who reported particular comorbidities across each age group, you can see that hypertension in orange and diabetes in gray are responsible or implicated in most deaths, particularly amongst the older age groups. You can see that a large proportion of the deaths had hypertension and comorbidity and diabetes as comorbidities. But in the younger age groups, the under 20s, the 20 to 39, you can see more patients who had HIV and TB and obesity compared to hypertension and diabetes. So there's a complex sort of interplay of being diagnosed with COVID-19, having underlying comorbidities, and actually having multiple comorbidities, because many of the patients that were admitted had, 2 or more comorbidities. And these obviously contribute to mortality. When we do a multivariate analysis, looking at the risk factors associated with in-hospital COVID mortality, and this is the most recent analysis done in the last week, we know that there's an increased risk for males compared to females in terms of mortality. Risk increases with older age, and that's actually the biggest estimates. So when you look at these are the odds ratios on a log scale, and you can see compared to all the other risk factors, the adjusted odds ratio for age are huge. So the biggest risk factor for COVID mortality is increasing age. Of course, non-white race is associated with increased risk of COVID mortality. Medical conditions such as hypertension, diabetes, chronic cardiac disease, chronic kidney disease, cancer, obesity, TB, and HIV are all associated with risks for COVID mortality. Being admitted in the public sector has a higher risk of mortality compared to the private sector, and being admitted in certain provinces has a higher risk of mortality. But I wanted to focus particularly on the wave period. So we compared patients admitted in wave 1 with those admitted in wave 2, 3, and 4. And as you can see, the adjusted odds ratios here on the right, compared to wave 1, if you were admitted in wave 2, you had a 50% higher risk of dying. In wave 3, a 30% higher risk of dying. But if you were admitted in wave 4, when Omicron dominated, you had a 50% lower risk of dying. And so, I think what has already been reported in the literature and also in our South African data is that there was a higher risk of dying in the Beta and Delta waves and a lower risk of dying in the Omicron wave. Thank you so much for your time. We're happy to take some questions after.
Thanks very much, Dr. Vasily Yathat and Dr. Michelle Gu from NSFT for that update as far as epidemiological report is concerned. So without wasting any time, I'm going to hand over to Dr. Chris to provide us with the update as far as vaccination is concerned. Over to you, Doctor.
Good morning, everybody. Good morning, Foster, Minister, Deputy Minister, DG, and colleagues. While I just find the place to share, here we go. Okay, thanks very much. So I thought what I would do is, first of all, just show where we are now, and then look a little bit, just in a couple of slides, of what has happened since we have made some changes in the vaccination schedule. The Minister referred to this. But I want to start by saying COVID is definitely not over. The Minister made that point earlier, and we can't emphasize it more. COVID still kills people, even if it kills fewer people. It still makes people really sick, even if it puts fewer people in hospital, as we've seen in the figures. So in terms of our vaccination status, we announced a short while ago some changes to the schedule, and there's still 1 or 2 more changes coming. So I'll talk you through this slide very briefly. So the options at the moment are that we have a primary schedule of a vaccine. This is the Comirnaty, is the Pfizer vaccine. And now we've reduced it back to the original 21-day interval that we had at the beginning of the vaccination program before you get a second Pfizer, and that's the primary Pfizer schedule. Then what is available at the moment is a 90-day interval, which was going to be 180 days, but this is the evidence in the countries that we've looked at is that from 90 days, there's a very good immune response, and it is perfectly safe. So for persons under the age of 18, we do not provide boosters, but over the age of 18, 90 days after the primary schedule. And now there is what we call heterologous boosting, or boosting with either of the 2 vaccines. So after the 2 doses of Pfizer, you can either get boosted with a Pfizer or a Janssen, a J&J dose 90 days later. The second option is that you get one dose of Johnson & Johnson, and 60 days later, we offer a Johnson & Johnson or a Pfizer dose as a booster. Now, this will also be augmented in the coming days, where some people got 2 doses of Johnson, and we are now going to offer a Pfizer booster after that. That will be announced shortly, and obviously that will be probably taken up the earliest by healthcare workers, since that is the schedule that they were given as part of the Sisonke study. So where are we at the moment? Minister referred to the total number of vaccinations approaching 32 million doses. It's quite interesting to note, although Gauteng's ratio to total population is not the highest, because of the sheer numbers in the province, they are approaching 9 million vaccinations, which is a massive effort, combined effort of private and public sector vaccination program. They're very well on their way to 9 million. But I want to turn attention to the right-hand side of this graph. These are the province's vaccination trends in doses administered per week. And you're very familiar with this, I'm sure. This is on the public dashboard, and you can watch what's happening. So this was the growth in the vaccination program, with the period where we had started to run out of stock. And then we got the donated Pfizer vaccine, and we started settling down into the Johnson & Johnson delivery schedules, and things picked up tremendously. In all provinces, the pattern is the same, except, of course, KwaZulu-Natal during the violence in July last year. But what has happened now, since January, is in December, when we were all sort of burnt out and tired, and we were struggling with Omicron and really wanting to get a break, we had this huge decrease, very worrying decrease in vaccination. But it has picked up substantially in the last couple of weeks. And with the changes to the schedule and the access to vaccinations, we are seeing in all provinces quite a nice pickup in the number of vaccinations that are taking place. But where are the gaps? So we've got 19 million individuals vaccinated. So that's this excludes the children, the 1 million below the age of 18. But 19 million adults are vaccinated with at least 1 dose of Johnson & Johnson or 2 doses of Pfizer. And this is where we need to increase our numbers. Although the population between the ages of 18 and 49 are large numbers vaccinated, as a percentage of the total population in those age groups, we're still quite a long way to go to get a really good coverage like the 70% that we are striving for across the whole country. So this is why you will have seen the efforts that are being put in the public space is to get hold of younger people, especially the 18 to 34. They started vaccinating long after the older population, so there's a lot of a time lag to catch up, and especially with the male population in these 2 groups lagging behind the female population. Here you can see we are now looking at individuals vaccinated to see what is happening, who is coming for vaccination at the moment. And this is the concerning trend, is that in the last month and a half, we are seeing a fewer number of new people coming for vaccination. So although we're still getting larger number of vaccinations, this trend tells us that it is people returning who have previously been vaccinated, and the total number of new people who are being vaccinated is relatively small. That means we are not getting our herd immunity from vaccination or our boosting from vaccination up fast enough. You can see this on the public dashboard, where it shows that these 19 million adults constitute 47.9% of the adult population. And as the minister indicated, there are 4 provinces now that are above 50%. And that's very encouraging because there are large population provinces included in this, like the Western Cape and Limpopo and the Eastern Cape. And then Free State's a slightly smaller population, but they're doing extremely well, approaching 60% of the adult population now vaccinated. I also want to emphasize this because it's come out in the two previous presentations and in what the minister said in his introductory comments. And this is who is ending up in hospital and are they vaccinated or not vaccinated. So I've chosen just one slide. If you go to the public dashboard, you can filter and look at using these tabs on the left-hand side. You can select what you want to look at by province or by age group and look at different analyses. And it will give you a very quick picture like this picture on the right-hand side. This, what I've got here is the whole country. And looking at the whole country, first of all, you can see male and female admissions. And the green is those who have been vaccinated. The orange is they have only partially been vaccinated. And the red is the unvaccinated people in hospital. And there's a small group unknown. They didn't declare the either male or female in the records. In the age group, age bands, you saw that relatively small number of 12 to 17-year-olds are admitted, and that was shown very clearly by Wasila a moment ago. But this is the concern, is in the 18 to 34-year-olds, it's such a huge proportion of this population that is hospitalized is unvaccinated. So out of 590, 510 are unvaccinated. In the older population, where you expect people to have, as we've seen, more comorbidities, more chronic diseases, there is a larger number of people where there is, let's call it immune escape. They've been vaccinated, but they still got sick with COVID. So this is the population we really need to concentrate on now to protect. From a health perspective, obviously, we're interested in everybody, and we need to protect older people as well. So what has changed, and has the change in our schedule made any difference at all? So here I'm just looking at a couple of slides comparing the 16th of February with the 2nd of March to see what has happened. In all provinces, there's been a difference in both the public and the private sector, quite a significant positive uptake of vaccinations, 46%, 57%, and so on. These are the percentage growth over that period, comparing a 24-hour period on the same day of the week. And in the private sector, one saw massive growth in the Eastern Cape, KwaZulu-Natal, and Limpopo. And in the Western Cape public sector sites, we saw a growth of 66% in the vaccinations. So this is very encouraging. So in these figures, you can just see the overall, the actual numbers that were on each of those days with the differences. So in terms of geography, what changes have we seen in that same period? Well, in Mpumalanga, which is the province we've been concerned about lagging behind, everybody's aware we've been some 42% of the total population vaccinated. We saw the largest change, 1.7% pickup in the vaccination tempo. But very encouraging is Gauteng. There's been a huge effort in Gauteng, both in the public and the private sector, to increase the number of vaccinations. And Free State continues to do well with their program. Also encouraging is a larger number of males are coming, with a 20% increase in that period. And in the age group that has picked up the fastest is the 18 to 34-year-olds. So these have been our geographical, gender, and age targets, and all of them have responded positively in this period of the last couple of weeks. Thank you very much.
Thanks very much, Dr. Nicholas Chris, for that update as far as the vaccination is concerned. We are doing well in terms of time, and we've got received about very few questions. I'm going to read out all the questions before and allow the panel, minister, deputy, and the panelists to respond while waiting for the second batch of follow-up questions. The first batch of questions read as follows. When will the healthcare workers be given opportunity to get Pfizer booster after the second J&J dose? The evidence doesn't allow the healthcare workers to get the second dose either from J&J or Pfizer, which is a heterologous booster, as Dr. Chris announced this. The second question, can you elaborate on why asymptomatic COVID-19 infected staff at health facilities and care homes should stay away from workplace for 5 days from the date of the test? Majority of these workers cannot work from home, and this regulation continues to add pressure on the healthcare system. Third question, what amount of vaccines does South Africa have currently? Does the country expect to use those stocks, and will there be some risk of this vaccine being destroyed? And if so, how much? The fourth question, when will our population access the whole virus vaccine? Perhaps some hesitant people will trust this more natural vaccines. I don't understand this question, but if the panelists will understand it better, they can assist to unpack it. Question number 5, good morning, Minister. The US drug maker J&J has announced last month that it's going to close a vaccine licensing deal with South African group, a company called Aspen Pharmacare. Will you have any new information regarding these discussions? Last question, SAPRA has authorized access or the use of COVID-19 pill in the country. When will the government, when is the government going to roll out this pill? This is the first batch of questions, Minister, Deputy Minister, and members of the panel. I'm going to hand over to Minister to lead in disposing to these questions. Over to you, Minister, and members of the panel.
Well, thank you very much, Foster. Just looking at the questions, can I ask Dr. Crisp if he could deal with the first one? I think he's touched on, but there's, I think, more elaboration required. On the second one, on asymptomatic COVID-infected staff having to stay away from work for 5 days, Dr. Buthelezi, if maybe you could be thinking about that one. I will take 3, the one on vaccine stock, but I'll ask Dr. Crisp to add on that. I'll just do the introductory part of that, number 3. And then number 4, the whole virus vaccine. Yeah, I'm not sure whether we don't have a vaccinology on the platform, but maybe Dr. Crisp could double up as a vaccinologist in terms of the whole vaccine, the whole virus vaccine. And then the number 5 on J&J and Aspen, I think is directed to me. I'll deal with that. The one on the COVID pill, which is approved by SAPRA, between Dr. Crisp and DG Buthelezi, I'm sure they could look at dealing with that. So let me just immediately start on the question number 3. I will not give the actual number of vaccine doses available, but let me just confirm that we do have more than 20 million vaccine doses on stock. Now, at the current moment, we are pleased with the pickup in terms of the vaccinations as reported. There is definitely a risk that at the current moment, there is a risk that just over 100,000 or so doses, which will expire at the end of March, that those may have to be discarded. So there is that possibility. We're looking at that, working around, seeing whether there may be other alternatives, but it does look likely at this stage. In as far as in the medium to long term, 2 things. One, we're hoping that with various efforts, there will be further up, more people coming forward for boosters, for primary doses of vaccination, which it will be a sad day if significant volumes of doses can end up being discarded. We hope that it will not reach that stage. But just in terms of planning what we are looking at, its various strategies through discussion with various partners, including COVAX and other within the WHO family, within other partners within the continent as well. We're working at various possibilities, modalities through which, as we move, as we see the rate of uptake, there can be some kind of exchange of vaccination, of vaccine doses through these various platforms, so that if 2 or 3 months ahead of time, we see that a certain number of doses may not be totally utilized within that period, we reach an agreement with some of the partners, so where they're having a more faster uptake, so that they can take our doses, and then at the time when we are ready for additional for return of those doses, then we can get a return of those. So there's exchange program which is being discussed with various partners, so that we could be able to plan ahead of time, so that we can be able to save those vaccine doses. And as time goes on, as more people come forward, we can be able to utilize them. So the risk is there. Unfortunately, there's definitely a risk, but we're hoping that as more and more partners in terms of the demand generation, as we mentioned earlier on, 2 weeks ago, we had the young people who are taking forward their own campaign to encourage their peers, as indicated that the 18 to 34, if you include also the 35 to 49, there's still a big possibility of uptake in that cohort. So there are all those kind of interventions which we are working on. The issue of Aspen and Johnson & Johnson, the details can only be explained by the 2 parties, but what we were informed by Aspen is the fact that they had reached an agreement with Johnson & Johnson. As you know, currently, Aspen has a contract with Johnson & Johnson where they are doing the filling and finishing of the Johnson & Johnson vaccine, and just the end part of the production of the vaccine, what is called filling and finishing. But what they indicated was that they now have an agreement to actually acquire the actual intellectual property of the formula for the production of the vaccine, so that they could actually do the actual production right from the start. So that's the agreement which Aspen had indicated that they had reached with Johnson & Johnson, but they are in a better position to speak to that, because as government, we are not directly involved. That's a kind of we appreciate such a development, because we want the transfer of technology to various parts of the world, and in our case, especially to the African continent. So we appreciate it, but the details are really with the parties. Can I ask Dr. Crisp and then DG Buthelezi to take up some of the other questions?
Thanks, Minister. Yes, over to Dr. Crisp, followed by DG.
Okay, thanks very much. I saw the DG's hand is up, and so maybe I should defer and ask DG to answer the question first, and then I'll fill in on the other technical details. Thank you.
Thank you very much. Good morning, Honorable Minister, Deputy Minister, colleagues on the call, members of the media. I'll deal with the question on the isolation. The regulations that were changed a month ago, they are very specific that for asymptomatic individuals, there is no isolation required. But for mild disease and severe disease, the period has been reduced to 7 days. So people who are asymptomatic, of course, they still need to take a lot of care and try wearing the mask all the time. But there is, in terms of the regulations, they don't have to stay at home. The isolation has been done away with. Thank you very much. Dr. Chris, you can deal with the specifics on the vaccine questions. Thanks.
Okay, thank you very much. So I was asked to cover the question in a little bit more detail about when will healthcare workers be given the opportunity to get the booster Pfizer. So this has been discussed at length in the Vaccine Ministerial Advisory Committee, and that committee has made a recommendation to the minister, and that heterologous boosting with Pfizer after a 2-dose primary of Johnson & Johnson is what we are going to implement. So we are busy right now, and in fact there was a meeting this week where we went over the entire schedule again to check that we have covered all bases, because we need to make the amendments programmatically on the EVDS system to allow these things to happen. There are a number of other programmatic matters that need to be changed, including what we do with people who are vaccinated with other vaccines outside of the country, who now want to get another dose here, etc. So these are being programmed at the moment. I'm hesitant to say that it'll be available this day or the next day, but within the next week or so, I would expect that we have managed to do all of that programmatic change and send the circular out to all the sites so that they know. There's confusion among some vaccinators at sites because there are so frequent changes that they don't all get the information. Remember, they're working on shifts and in different places as well. So we need to make sure not only do we change the schedule, but we train people and make sure that the information gets across through the training platforms that we have. So it is coming, and it is not far off, and I certainly expect within the coming days that will be announced and available to everybody. The minister has already answered the question on the doses that we are trying to manage on expiry dates, but I will add some detail as he requested. We do indeed have 25 million doses of vaccine in the country at the moment, and 13 million of those doses, I'm rounding off obviously, are Pfizer doses. Now, Pfizer is a far less stable vaccine. It's more difficult to store. The logistics are more complicated because it is stored at very cold temperatures. And once it is removed from those cold temperatures, it also has a limited shelf life before it has to be destroyed. Well, all vaccines do, but these are relatively short compared with other vaccines. So the Pfizer vaccine is the vaccine that has the shortest expiries. When we get that vaccine, it has between 7 and 9 months shelf life. And if we are unable to use it in that period, it has to be destroyed. It can't be used. So obviously we need to move it to get to use all of the vaccine that we have. Now, the first of our Pfizer vaccine that we have in store at the moment expires on the 31st of March, as the minister said. We've been encouraging vaccination sites to use that vaccine, but we don't want to put vaccine into the distribution pipeline of vaccination and distribute it a few days before people are expected to use it. That would be irresponsible, and it would put the burden on to those sites to end up with expired vaccine. And then destroying expired vaccine in hundreds of sites all over the country is logistically very difficult and can lead to all kinds of other environmental challenges and potential fraud. So we prefer that when we can see that the uptake is not going to be adequate, we would rather destroy vaccines centrally where it can be controlled. And as the minister said, we've wound it down from a risk of just under 500,000 doses to just on 100,000. And at this stage, we are trying to manage to see if some sites are able to take up that vaccine. Otherwise, that's what's at risk, is around 100,000 doses for now. Now, obviously, there's next month's expiry. There's those that were delivered that expire at the end of April. At this stage, the orders have covered all of those vaccines, so they've not been delivered yet. So for April, we do not expect a risk. But from May, June, and July, the numbers of doses that are going to expire increase. And those are the ones that Minister was referring to, that we are in the process of trying to swap out with countries and jurisdictions that need vaccine now, and get a longer expiry date vaccine in replacement at some point. These are international agreements and international discussions, and they take a bit of time, but that is what we are doing. And I think the Minister's been very clear on that. So we are doing what we can. Obviously, if we can increase the demand for vaccines, which is what we really want, and this links with previous things that have been said by the Minister and by the colleagues from NICD and what I said earlier, if we can get to 70% plus of our population vaccinated, we can open society much more. Yesterday, we heard in a discussion that Minister was referring to that Italy and Oman have already vaccinated 92% of the population. Recently, we had an engagement with Norway, where we heard they have more than 90% of their population. Brazil's reported more than 70%. France, we know, is close to 90%. So when one hears in the media that these countries are opening up their stadiums and so on, they are not sitting at 45 and 50% vaccination coverage. They are well vaccinated, and that's why they're able to do it. So we need to push our vaccination coverage to way more than it is if we want to open up society and enjoy the privileges of working there. Minister said I should try and be a vaccinologist. Well, there are different ways of making vaccines, and there are different types of vaccines available. And what's being referred to with the whole virus vaccine is where the actual virus is taken and partly destroyed, and parts of that vaccine, the spike protein in particular, is damaged in a way that it doesn't infect you, but the protein is introduced into your body. So it's not an artificially manufactured vaccine. That's what's being referred to here. So that's why the person who asked the questions talks about a more natural vaccine. We have plenty vaccine in South Africa, plenty very good vaccines in South Africa. We know they are safe. We know they are effective. We know that if we give boosters of them, we get very good long-term immunity with cellular immunity being boosted. So for now, while we have this huge investment, we are going to use the investment, and we do not envisage introducing any of these other vaccines into the vaccination program. Lastly, there was a question that I was asked to respond to about molnupiravir, which I can never pronounce. We have a committee, a standing committee that looks at all essential medicines called NEMLAC, and that committee has looked at all the drugs, all the treatment modalities. And they compare statistics from around the world and studies that are done to have a look, first of all, is it effective? Is it better than what we have? Does it produce a better outcome at with reducing stay in hospital, et cetera, et cetera. So it's a very intensive program that is looked at. And the advice they've given us, even before we got to the pharmaceutical economic evaluation, in other words, the price value on this product, they recommended to us we do not introduce it because it does not add significantly to what we already have available. So for now, although SAHPRA has registered it for use in the country, we will not introduce it into our essential medicines list, but it is available for sale, and there may well be private sector providers who choose to prescribe it to their patients. Thank you, Foster.
Thanks very much, Dr. Crisp, Minister, DG, and other colleagues. I've got the second batch of questions, about 7 questions. Some of them they have already been answered, but the person who's asking apparently said he hasn't, by the time he was experiencing some technical challenges. So The first question of the second batch, is there any possibility of a fifth wave? Any possibility of the fifth wave? Second, are school children allowed to take off their masks during breaks, and why? Third question, a lot of people are asking whether masking up outdoors is helpful. What is the evidence we have in this regard, if we do have? Next question, the prevalence of COVID-19 in South Africa is about 25,000 plus active cases of 60 million plus a population size. What does this mean in terms of disease severity or impact to South Africa? Honorable Minister, what about the issue of the removal of PCR tests for the travel market? Bear with me if I miss your statement on the issue due to network problems from the time. As I said, that the others who joined late, but they feel that their questions, if they were not touched earlier on, we can still feel free to touch on. Next question, vaccine administered is an input indicator of 31 million plus. That is reflected daily on our dashboard. Why are we not reporting on the vaccinated individuals as an output indicator instead of the input indicator? Lastly, on the 1st March, there were about 7,930 recoveries from 2,892 admissions of the previous day. How was this number possible? So apparently the numbers don't, it doesn't make sense here. The recoveries are more than admissions, but the colleagues can assist. Next question, good morning, Minister. You mentioned that 100,000 doses expiring at the end of March that may need to be discarded. Are the majority of these doses Pfizer or J&J? And could you talk more about the exchange program that will stop the vaccines going to waste? I know Dr. Crisp touched on this, but if you feel you still want to further clarify this, feel free, Dr. Crisp. Next question, someone from the tourism sector is saying he or she has a delegation of 10 people coming from the US next month for a site inspection. However, they are concerned about the PCR test requirements that is currently in place. Even though Minister did touch on this, said the discussions are ongoing, but feel free to elaborate further if you need. The last question, Minister Patla, is there any prospects of a reduction of restrictions on outdoor events? The event industry is struggling to survive. The hosting of events have a large impact on rural economies. Some of the questions, as I said, they were partly covered during the speeches or presentations, and also during the responses of the first batch of questions, but the panel can feel free to further elaborate if you feel that you need to emphasize what you have already touched on. So I'm going to end here and hand over back to Minister and members of the panel. Over to you, Minister.
Well, thank you very much. Yeah, I've tried to see. Can I ask Deputy Minister if you could handle the second one of the second batch, the one on masks and children at school. And then let me just see the ones which I could also just quickly deal with, and then the colleagues. But clearly the one number which one is this? The number 10. Prevalence of COVID and so on. I think, no, that one can go to our NICD colleagues. The severity, what does it mean? The active cases, and what does it mean to the country? I'm sure the colleagues from NICD could deal with that. The issue of PCR, I'll deal with. That is on number 11. It's also relating to the last question on which relate to traveling from the US. So in the interest of time, maybe let me just, if I can ask the other colleagues just to look at the ones they could deal with. The first one in terms of the fifth wave, well, I'm sure our NICD colleagues could also weigh in this one. Well, from all reports and expectations is that from modeling expectations through the WHO and other bodies, the expectation is that there will continue to be mutations and variants, and as long as those variants are happening, and as long as we keep on opening more and more interaction amongst people, more activities, there will be another wave, the severity of which, of course, will depend on the number of people who are vaccinated, and also including also the natural immunity from those who have already been infected. But the more reliable, protection in terms of against these waves is the vaccination, and of course also that the more people get vaccinated, the likelihood of reducing also the mutations and the variants is also very positive. So in the immediate future, especially in our country where our vaccination coverage is still fairly low, below 50%, even in terms of just one jab. So the likelihood of a next wave is very high. And as we have said, probably as we go closer to winter, we expect that the fifth wave will probably come. Its severity will depend on how we protect ourselves. I'll take the question on the PCR for travel markets. Now, we are part of what we are reviewing, which we will be reporting to the next Coronavirus Council, the NCCC, will be proposals in terms of changing the requirements for traveling. There are a number of proposals which we have looked at, some of which also came from our Ministerial Advisory Committee. So we will make those proposals, which hopefully will make it much easier for traveling. But the details of those at this stage, I'm not at liberty to go into detail, except to say that indeed there has been a lot of discussions. Also, proposals from some of our neighboring countries have also made proposals in terms of the traveling in the land borders, but also from the travel industry, there have also been proposals. And combining all this with the Ministerial Advisory Committee, we have developed proposals which we will be taking to the NCCC. And if they are approved, there will be an announcement in terms of changes which will make travel hopefully cheaper and a lot more easier. So I think that deals with that question. Can I then just ask the other colleagues, maybe Deputy Minister on the schools and masks, and then other colleagues could also weigh in on the other matters.
Thank you very much, Minister. On that part, we would just want to say there was a presentation made by the NCCC, which then assisted Cabinet to take a decision that it would be good now to actually stop the rotation attendance of learners, which was greatly appreciated by the Minister of Basic Education, because it was causing a bit of a challenge for them to have students and learners rotating. And now that has since been removed. However, the wearing of masks is still a real request that we must continue with it. Why? Because while they are now getting and sitting close by, you by wearing a mask, you're still reducing an opportunity of any sneezing, coughing from this one learner to the other. So we really encourage, and they have not stopped. So the Minister of Basic Education was actually happy to learn that we could then relax this distancing of a meter in between, but retain and keep the mask. So we would still request that learners must wear masks. And most of the panelists here, starting from the minister, are saying COVID is still with us. COVID still kills. So we would not really take all other these restrictions in that one. Thank you very much, Minister. Over.
Well, maybe as a follow-up to that, just to say the next question about masks outdoors. Again, this is a matter which is subject of discussion. There's advisory from the Ministerial Advisory Committee, on the basis of which, with other inputs as well, we are taking a proposal to the NCCC. So this, again, it's something which we have really examined. We have received advice, and there will be some possible changes once this matter has been discussed thoroughly by the next NCCC. Can we maybe on that note ask the colleagues from the NICD to weigh in on the issue of the active cases, what does it mean in terms of the impact on the active cases? Yeah, I'm sure the colleagues got that question.
Thank you. I'll try and answer this on behalf of Michelle, who's had to leave the call. You know, active cases is a very difficult measure to continue to use, and we have proposed no longer using this because it doesn't really add very much. As we move in our COVID response towards, you know, a new phase, I think what's most important to continue to monitor is the number of hospitalizations and deaths. And to use that information to base any of our decisions on further response measures from the National Department of Health. However, it's still important to do surveillance of cases, surveillance of genomics, so that we can report on any new variants. But you know, what does active cases mean? The fact that you reported 25,000 active cases, which makes up 0.04% of the population, is not really any indicator of what you know, the impact of COVID has been. That just tells you that we're at the end of the current wave, that there are a number of people who have not yet passed their isolation periods and or been discharged from hospital and are still not fully recovered. But you know, it doesn't tell us about the impact of the epidemic. And what we have to understand is that there's been a high burden of COVID-19 in South Africa. In terms of reported deaths and excess deaths, South Africa is one of the countries most affected globally with severe disease of COVID-19. And I think these things can't be discounted. And I think better measures of the severity and the impact of COVID-19 has been, you know, should be the hospitalizations, severe disease, and the mortality, rather than the active cases, which we don't think is a very useful indicator to measure the epidemic. Thanks.
Thank you very much. I'm sure Dr. Crisp, I didn't understand clearly the question about inputs and outputs. Administered vaccines are the input, and the people vaccinated are an output. I'm sure you might have understood it better. And then also, I don't know if Dr. Jasat, the next one on whether it's from DATCOV, I don't know where those figures come from, the recoveries and admissions, the numbers which don't tally. But let's start with Dr. Crisp on the that input output.
Yeah, thank you very much, Minister, and thanks for the question. We're not quite sure which figures and which dashboards are being referred to here, but the department puts out a one-page poster every day, which is supposed to be just you know, figures that people are watching in the community, and there's been interest in that from the beginning from the media. But so that maybe that is where that figure is seen as an input. But as far as we're concerned, they are output indicators, and we have a number of slides 7, 8, 9, 10, and 11 on the public dashboard on the SA Coronavirus vaccines administered are an output indicator. So I think maybe if the person who's asking the question ignores the poster, which is intended for a different audience, and spends time with the dashboard, it might be easier. Otherwise, contact us and then we will discuss that. Minister, if I can just briefly refer to, just reiterate what was said about the doses that are expiring. It's all Pfizer. None of our Johnson & Johnson vaccines, the 11 million doses that are presently in the country, none of that expires this year. It starts to expire next year. It's got a much longer expiry date, and it is all very safe in various cold rooms around the country, and obviously under high security. It is completely safe and it's not expiring. So we're talking here about Pfizer doses. And then the exchange program is really just what the minister said and what I added to. It's there are countries who are struggling to get vaccines at the moment. I mean, Africa's coverage at the moment is 10%. 10% of the African population, adult population, is vaccinated. That is crazy if you look at the European countries and others that are 90% plus. So there are countries that need vaccine and need it now, but one wants to give them vaccine that's got a fair chance of being used. And so that is what the international partners and the regional partners are looking at, to see whether they could use some of our vaccine now, and we will get replacements down the line when we are also able to use it more easily. Thank you, Minister. Thanks, Foster.
Yeah, I'm not sure about the one on the figures. I was checking with Dr. Jassat whether it makes sense, whether this comes from DATCOV, the questioner who asked about the numbers which are not tallying, about the admissions and recoveries, where recoveries seem to be more than the admissions. I'm not sure if I don't know what is the source of that. Maybe you may understand it. Dr. Jassat?
Sure. So, what's constantly reported and has been reported for 2 years now every day is the number of cases, the percentage testing positive, the number of hospital admissions, the number of deaths, and these data have been available and have been tracked and monitored for a long time. There are also a number of sort of calculated indicators. And so the provinces look at the number of cases they've had, at the number of hospitalizations, and then using that data, work out the number who have recovered and the number who are still active cases. And so, if a number of patients had been admitted in the last day or the last week, those are data that's reported from our hospital surveillance system at NICD. Now, the calculation of recoveries considers all the cases that had been diagnosed in the last few weeks, those that had passed their isolation period or been discharged from hospital, and then are considered as recoveries or active cases. So it really isn't dependent on the number of admissions in the last day. It's a calculated indicator really of the number of infected people, and subtracting those who had finished their isolation period and those who had been discharged from hospital to give you the number of active cases and the number of recoveries. So I think those two are not really related, and I'm not sure that I understand why it's believed that it's a discrepancy, that if 2,800 were admitted in the last day, the reason why there are 7,000 recoveries is because these are data calculated by the provinces in terms of all cases over the past few weeks. I hope that clarifies that question.
Thank you very much. So basically, to that question, the long and short is that recoveries don't relate to recovery from a hospital. It means recovery from an infection. So many of the recoveries are recovering from home. They've been positive, they might have had mild illness just at home, and they have recovered. So it's not necessarily meaning people who have recovered from a hospital admission. I think that's quite clear. Okay, Foster, back to you. I think we have dealt with, and I think probably our time is also out. Back to you.
Thanks, Minister and DG colleagues. We are now going towards the end of the briefing, but just before I hand over to the Deputy Minister to wrap up. Just want to check with the Minister if we don't have that last parting shot message encouraging people to continue vaccinating while even though the pandemic is under control for now. Over to you, Minister.
Well, very briefly, I think just to emphasize that the only thing which is holding us back in terms of what many people are aspiring for, further opening up, many activities, big sporting, hosting big sporting and recreational activities, music festivals, all those kind of, this would all be much easier if many more people would come forward to be protected. So our lives, to reclaim our lives, it's highly possible, and it's really in our hands. And if we can use the available opportunities, a lot more activities, economic and social activities can be possible in our country. And we again appeal to South Africans, those who have not yet come forward, to come forward, and those who are eligible to get further boosters also to come forward. Thank you very much, Foster.
Thank you, Honorable Minister, for that parting short message. Now I'm going to hand over to Deputy Minister Dr. Sungsen Tomo to do the wrap up. Over to you, DM.
Yeah. No, thank you very much, Mr. Foster. It is mainly the message that the Minister was actually bringing to us today. But firstly, to just start by thanking the NICD team that was led by Dr. Michelle Groom and Dr. Jassat. They continue to support this department in terms of the epidemiological picture and the number of cases, tests, and deaths, and be able to give a meaning to that. We really thank them very much. In the Minister's opening remarks, he mentioned a desire to open up 4 times. Now, again, now in his closing remarks, he is mentioning that point. That point also came in from a scientist, Dr. Groom, and Dr. Nicholas Chris. Now, there's a plea largely to a population group of 18 to 34 years in the country that they are vaccinated up to 34%. We would wish that these numbers could go up. Yes, it is actually encouraging that over the past week, we saw a bit of an increase from that age group, but we want to see more and more of those coming in. Now, that is going to be very helpful because in any society, people who tend to be very much available to be in the sports activities, entertainments, visiting the stadia are usually in this age group. Now, any one of in this age group, if we want to say to you colleagues, who is holding you back in terms of filling in the stadia, is some of the colleagues and the youngsters in this age group. Now, we are sitting at 48% vaccinated as a country. We would not wish to push the minister to say, please, minister, must behave like we are 70% vaccinated. I mean, there's been minister meeting other ministers in the world indicating they are 90%, 70% vaccinations in their country. So if you are vaccinated to that level, then you are unlikely to stop entertainments and all the other processes. So we still wish to really plead. There was and still is a campaign led by the Deputy President supporting the Minister of Sports, Arts and Culture, Minister Mthethwa, on the Let's Go Back to Play. And that is also, again, amongst other things, encouraging. So the minister is saying we have enough vaccines. We might even lose some through expiry. But South Africans have not vaccinated to the level that we want to be. So, and the minister has taken vaccines to the malls, to the taxi ranks, to the places of worship, everywhere, every corner you do find vaccines. So it is very accessible. And our main plea, South Africans, is to say, let's vaccinate, and therefore we can go back to opening up our economy, our sports activities and entertainments. Thank you very much, Foster. Over.
Thank you, DM, for that powerful message. Indeed, we are not yet off the hook from this pandemic. Let me take this opportunity to thank Minister, Deputy Minister DG, Dr. Chris, colleagues from the NSAD, members of the media for being with us. This media briefing stand agenda. Thank you.
Thank you very much. Thank you, Foster.